we were talking about core services for mental health and addictions, and I guess I was a bit skeptical about the utility of core services, and there's an awful lot of time that goes into trying to sort out what are the core services. I think there's a relatively, there's a fairly good consensus about the broad range of things. It's at the level of really fine distinctions that the conversation gets stalled a bit, but I would say there's a fairly good consensus around what should be in these basket of services. And I think there's also, I would say, just by the fact that it prompted so much conversation, there's also, I would say, more utility to the use of a core basket of services as a way to be thinking about what the system needs to do and how it needs to do it. Well, there's a Mental Health and Addiction Leadership Council in the province of Ontario, which is the sponsor of this building of the core basket of services. So I think this is part of a number of consultations they're doing. It's a fairly well organized way to do it, and I think really they'll start to build towards some consensus that they'll then be able to use to take back to the provincial government to kind of advocate for things related to funding the core services. So I think that's a fairly clear pathway for this to proceed. I think, ultimately what I would do personally is, I'm part of different things related to the Leadership Council. I'm on work groups and things like that. So I'm better informed about what a variety of people think about this, so I can also help articulate to people that I talk to in my work what the thinking is, what's gone into the deliberations about the core basket of services, and lend my support to that as much as possible.